Hi, moms. I'm so excited about today's guest speaker. I'm going to let her take it away from right now.
Hi, my name's Lynn Orsak. I'm a pelvic floor physio. I've been doing physiotherapy for 7 years and pelvic floor for 2. I love treating moms, new moms, prenatal moms. And yeah, I work at a clinic where we do physio and Pilates. And so I've got lots to talk about today and about how to avoid tearing in your delivery. So I've got my pelvic floor here. Just 1 second here.
It looks
There
great.
we go. Okay, awesome. All right, so the pelvic floor is 3 layers. You may have already seen this on Melissa's talk that's up on the birth prep yoga series, but I'll just do a quick review. So you've got the deepest layer here is your levator ani group. It's a nice kind of like hammock-shaped, U-shaped, deep in the pelvic floor. And that's kind of where most of the pelvic floor stability and strength comes from. And then you've got your next layer is kind of in between here in this model here. And that's where all your sphincters, so your urethra, your vagina, and your anus are all in that perineal membrane there. And that's often where the tearing will happen the most. So it usually happens kind of from one side compared to the other. Doesn't matter which side, everybody's a little bit different. But it usually happens from the vagina towards the anus along this perineal membrane. And then you've got another layer on top that doesn't really, it's more involved in sexual function, less so in the birthing process. So we won't talk about it too much, but you've kind of got bulbospongiosis on top. That's kind of the spongy part that you feel when you touch along your vagina. And then a few more smaller muscles around the clitoris and the other sexual organs. So there's pelvic floor. So like I mentioned, tearing happens typically back here to here. About 80% of women will likely tear during birth, which is kind of a high number. But there are ways that you can kind of avoid it or just lessen the risk of having a bad tear. The good thing is most women will have what they call a grade 2 tear, which may require stitches, likely require stitches, but only 5% of women tear worse than that. So a grade 2 tear is really, really common, but also really, really easy to fix and easy to heal. Our bodies know how to do it. Okay, so just 1 sec here. Okay, so let's talk about how we can avoid it or reduce the risk. So one of my favorite things to do, sorry, my computer is being funny. There we go. One of the best things that we can do is work on our breathing and our pelvic floor mobility. So the pelvic floor is actually kind of the pelvic floor is involved in breathing way more than we think it is. It goes with the diaphragm. So the diaphragm's up on top, pelvic floor is on the bottom, and they kind of work together when you take a great big deep breath. So I like to think about it as a bit of an elevator. So your pelvic floor, as you breathe in, your pelvic floor goes down, your diaphragm goes down, like you're going into the basement. And then when you contract your pelvic floor, like doing a Kegel, it's like going up to the penthouse. So the more mobility we can have in that elevator, the better stretch you're going to have in your pelvic floor and the less likely you're going to tear those muscles. Muscles, when they're too tight, like to tear. And that's muscles anywhere in the body. If you think of pulling a hamstring or pulling a shoulder muscle, that happens the same way. The muscles are really tight, they get overstretched, which is definitely what's happening during labor, and then we get a tear. So like everything else, those tears are totally healable because it's all soft tissue. Typically, I would say it takes about 6 to 8 weeks for the tissue itself to heal, which is pretty normal tissue healing. The first couple of weeks, everything's starting to knit back together. So you kind of want to avoid too much stretching during that period. But you can kind of do things like sitz baths. You can keep it cool. You can use ice packs on that area if it's tender. Those things are really helpful in the first couple of weeks while things are just sort of coming back together. You want to avoid tight clothing, anything that's going to rub on that area because it might be painful and might irritate that healing tissue. Your doctor, if it's a grade 2 or more, will likely do some stitches. Your doctor or your midwife will do some stitches after birth. which just helps that tissue stay close together, helps prevent infection. And then the stitches they're usually dissolvable these days, so they'll come out, and then the tissues will keep healing itself. And then around that 3 to 4 week mark, that's when you're going to want to start doing some more pelvic floor training again. So I guess going back to how to prevent tearing, you can do pelvic floor training before to help strengthen those muscles, to help you push, because a stronger muscle is always going to heal better because there's going to be more fibers, more blood flow. All of those things are going to be really, really good. So reviewing your Kegels, reviewing how to do a pelvic floor lift, and then also how to push into your pelvic floor, either using your breath. I call it a reverse Kegel, and you kind of think of it like blowing a bit of bubble gum out your vaginal opening. If you can kind of think about what that feels like, that's almost what that pushing is going to be like in a way smaller scale. But that can help lengthen the pelvic floor, stretch it out a little bit in a really strong way so that it can, have less chances of tearing.
So, Lynn, when you said, like, I love that idea of practicing stretching, that's on the exhale, right? So you inhale in and then you exhale and you imagine blowing that bubble.
Yeah.
Okay.
Yeah, when you're practicing that one. What I was talking about before with the breathing, the elevator breathing, so kind of trying to, so that way, that in the elevator breathing, your pelvic floor is going to lengthen as you inhale because you're kind of blowing up the balloon, but that's not necessarily what you're going to be doing when you're trying to strengthen the pelvic floor. That's just more of getting some more mobility out of the pelvic floor, and then strengthening is kind of actually the opposite breath. Like, yeah, just like you said. So you're going to inhale, exhale, push your pelvic floor like you're trying to blow a bubble.
Try to do a bubble. Yeah, because the Kegel's the opposite. It's inhale, relax, exhale, draw up that elevator, right?
Exactly. Yeah. So the reverse Kegel reverses the breath as well as it does the movement.
Perfect. So when you say tearing, you said there's, what are the degree of tears? 1, 2, how high do they go?
It goes to 4. So 1 is you're really lucky if you get a 1st degree tear. No stitches required. There's just usually a little bit of skin irritation, and it's same thing. Keep the area clean, avoid tight clothing, all those things that you would do anyways. A grade 2 tear, like I said, is the most common type. And so you'll have
grade 2, is that on the sides?
It's just a partial tear. Yeah. Well, it could be central. Some people do tear centrally, but it just doesn't. It's only through, sorry, I don't know if you can see this that well.
Yeah, we can see.
So, perfect. So from the vagina here, I've got it kind of backwards. Here, let's turn it this way. There we go. From the vagina, a grade 2 tear is only about 50%.
Mm-hmm. Yeah.
And then a grade 3 tear would be a little bit longer. And so those ones are more severe. And then a grade 4 is a complete tear right from the vaginal opening to the anus. So those ones usually or may require surgery. Those ones you might have to end up in the OR and get your stitching done in there. But hopefully that doesn't happen. It's really rare. Only like 5% of women have a grade 3 or a grade 4. And so it is way less common and can be even less common if you kind of can do some of the other things.
So to help avoid it, we are wanting to do practicing strengthening, because you said muscles that have more fiber that have less chance of tearing.
Less chances of tearing, yeah. Yeah, and because they'll help you push the baby out a little bit easier, and they're just stronger and they'll heal better. Another thing you can do to help avoid tearing is what we call perineal stretching or perineal massage. So your perineum is the area between your vagina and your anus. And so it won't look like this. It won't be red because there's skin and other tissue on top of it. But you can just massage that area to kind of loosen the tissue up. And you can also, if you're comfortable, either use a finger or you can use a vibrator or a dilator or something if you've got it, or a partner can help you, where you put your finger right inside that vaginal opening and you can kind of stretch down. You can stretch out to the side. Sometimes we'll teach people to do a peace sign technique. So you'll stretch down and hold for about 30 seconds, and then you come back and then you stretch out to one side for about 30 seconds and then to the other side. So that sort of peace sign thing that we all used to draw in middle school.
Yes, I love that. I love the peace sign stretch.
Yeah.
That's easy to remember.
Yeah, totally. And it kind of, so that P sign sort of helps stretch out that tissue, more the fascia tissue than the muscle, because the fascia also is a component of the tearing. So the muscles get stretched really well with the breath work and the reverse Kegels and the active work. And then the fascia help get stretched during like a passive hold stretch. So about 30 seconds, once or twice a day. I will say that if it's really, really painful and really, really bothersome, sometimes it can actually have the opposite effect on your pelvic floor because you tighten up and then everything, if it's painful, your body's first reaction is to tighten up. So if you can tolerate it, if it feels like it's something that's going to be helpful, that's a really, really great activity for you. But if you try it and you just go, no, that really hurts, I can't do it, it actually may hinder your progress because your body is just going to tense up even more. And we want to relax pelvic floor for birth. Strong, but relaxed. Just like moms, hey?
Strong but relaxed, just like moms, yes.
Yeah.
How about you don't start the stretching though until third trimester, right?
Correct. Yeah. I would say you could start probably, I mean, check with your doctor, check with your midwife or your pelvic floor physio just to kind of see. And if you're on pelvic rest, of course, nothing goes in there. But yeah, I would say probably like about 18 weeks, you could start gently doing it.
Around 18 weeks. Oh wow. Because
I think so. Oh, sorry. My math isn't mathing. Sorry. That's about middle of second trimester. I'd say about middle of third trimester there.
Yeah, 34 to 35 weeks.
34.
Right?
Yes, there we
Yes,
go.
there we go. I was like,
what's
oh,
my brain doing this morning?
Yeah, I know you had it. You were just in the, yeah. So yeah, you start in third trimester, 34, 35 weeks. And
Yeah.
like you said, some moms, it's not helpful. And I love that you said that because if you're going to tense up, then it's not helpful.
Yeah. Especially at 34, 35 weeks. That's when we're really trying to prepare for pushing, like relaxing stuff. Other things that are really good to kind of help earlier on are making sure that you've got good hip mobility throughout your pregnancy, because these muscles kind of, these guys in here, if you can see, kind of in the bowl. So that's your obturator internus and your piriformis. So those are actually hip rotator muscles, but they help support the pelvic floor. And if they're really tight, they can kind of pull these layers tight as well. They sort of pull the hammock taut. And that's another thing that we don't really want. So keeping your hip mobility really good in first and second trimester and just having overall good mobility as much as you can tolerate, of course, like your body's changing and you've got aches and pains and all these things, but that's where the yoga comes in and making sure that you can get like your good hip mobility but good strength and support as well. It's always kind of a balance between mobility and stability. We want that balance.
Yes, that was perfect. Thank you so much. Any last words about for any moms watching this that are afraid of tearing?
I guess it's just normal. It's like, I don't want anyone to be too scared about it because it does happen and it does heal. It really does. You can always, at about 6 weeks postpartum, head in to see your local pelvic floor physio and they can help you out and help you work on getting things strong again. But our bodies are meant to do this. It's a natural thing. Our bodies are meant to birth babies and have minor complications like tearing, and then they heal because we're super resilient as humans and as women.
Awesome. Thank you so much, Lynn.
You're welcome.